Hi, I'm Tice. I'm a respiratory care practitioner here in Southern California, and I'm also a clinical specialist. We're here with Invent Respiratory, and I'm going to show you a device that I'm very excited about. It's the HFT 150 high flow therapy device. It's very easy to set up, turn around, as well as adjust any settings. And the first step would be to get your disposables kit. When you open the disposables kit, you'll notice that the filter is on top. It's important to always insert the filter first. We're going to start off with the first item from our disposables kit, which is the filter. The filter comes with a little tool. When you look at the filter, there's treads on one side. Those treads go into the unit itself, and then the tool will screw the filter in. It's about 7 turns. When you're turning a unit around, you want to make sure that the last step you remove the filter. When you're setting up, you always want to insert the filter first. The tool itself you can just throw in the basket so you have it for removal afterwards. The second part of the circuit is the circuit itself. As you can see here, you have a magnetic pin connector. All of the heated wire systems are integrated in this disposable circuit, and they connect via this connector. So this is what you want to line up on the unit, which will be right here. And it clicks into place. Once it clicks into place, you can swivel the circuit to the position that you like. The third item in the disposable kit is the humidified chamber. And there's a button here to release the chamber. When you do the initial setup or turnaround, you'll take the chamber and you'll just slide it into position like this till it clicks. Also, you want to make sure that your vent cap on the feed is open to allow the chamber to fill with water. This disposable kit is designed to be removed after every patient. The unit can be wiped down right in the clinical setting. A new kit can be applied, as we've just shown. So very quick turnaround. You want to change all the disposables between patients, and if it's on a patient for over 28 days, you want to change out all the disposables as well. So the HFT 150 has many safety features as well as alarms. I'd like to review the alarm functionality with you now. As we take the unit out of standby, you'll notice that we're going to have a low FiO2 or a low oxygen alarm because I've unplugged the unit from the oxygen in the back. So you'll see oxygen flow low. With any alarm like this, you can go ahead and hit alarm mute, which will allow for an alarm silence of 2 minutes while you sort out the issue. Right now, we're just going to go down to 21% room air, and this will allow that alarm to be resolved. The next alarm would be patient disconnect. As the circuit is disconnected, an alarm will sound, tube disconnected, with the informational message here, and then the audio alarm. Again, you can choose to mute it, but now we'll just resolve it by reseating the circuit. The next alarm I would like to show you is the humidifier chamber unseated. So if the chamber becomes unseated like this, an alarm will sound and it will say tub removed, and the informational yellow note will be at the top of the screen. And again, we'll reseat it by pressing it in, and the alarm is resolved. So as you see, there's many different alarms. I would encourage you to reference your manual. The alarm section will go through the various alarms. We have low humidity, low heat, we have water level alarms and such. So please take the time to take a look at those alarms, the functionality, and how they work. I would also like to note that there's optional SpO2 that can be plugged into the back of the device, and there are alarms associated with high and low SpO2 with that function. As well, there's an integrated nurse call system, so the unit can be plugged into the nurse call system in the patient's room. So all of these alarms can be sounded at the nursing station if the room door is closed or the patient is in isolation. We're going to review the initial setup. When your unit first arrives, there's going to be a few connections on the back that you need to be aware of. Before you start with these connections, you want to make sure your disposable kit is installed. The first connection is the power. If you see here, the power has an anti-disconnect mechanism, and it goes a quarter turn to the left before you pull to disconnect. When you insert it, you can just push. If you want to remove it, remember to turn the wings a quarter turn to the left before you pull. Now step 5 on your guide will show how to plug in your pulse ox cable. This is the pulse ox cable. The plug-in is right here, and this flat piece right here, just like the mouse on your computer, will be facing up. So put your thumb on the flat piece and line up the arrow, and then it just clicks into place. If you would like to remove it, again, pull straight out. The 6th step on your quick guide, you'll see that you have your remote alarm function here. And this will plug in via this auxiliary plug and then to the nurse call system, usually at the head of the patient's bed. And then lastly, step 7, we have the high pressure oxygen. And that will screw into place right here. When everything is hooked up, you can turn your device on with the power button right here. Also, you want to note on the back, we have a little door right here. This is the door to the particulate filter. You press lateral and the door can actually be removed. And the particulate filter comes out just like this. We should check this and change it routinely. And then the door clicks back into place like that.